My name is Rebecca Hernandez, and my signature assignment was based on evidence-based practice, a change for the OR nurses to have interventions to manage their stress. So OR nurses deal with very high levels of stress. In the OR, they have long, demanding hours. They have an extreme need for precision and achieve positive patient outcomes. So OR nurses, their job is to assist in the surgical procedures that patients come in for to ensure their well-being and have successful outcomes. So before I read my PCOT, OR nurses are at really high risk for workplace fatigue, anxiety, and stress. They work long hours in high stress environments where there's need for extreme accuracy in the job, like perfection. A lot of the time they deal with many moving parts of the surgical team, including the surgeons, the surgical techs, preoperative nurses, and postoperative nurses. It takes like a huge physical and emotional toll on nurses in the OR. They work at very fast pace to ensure that every procedure goes as planned on time, and that they're ready for the next patient procedure that is on the schedule for that day. Job-related stress has a big impact on the nurse's performance, which can affect patient outcomes and also lead to potential medication errors, negligence in the care that they provide within the OR. So stress management for OR nurses is what the goal is for this study, which has led myself to establish this PCOT. For registered nurses in the preoperative setting, working in the OR, does having an intervention of aromatherapy compared to a placebo intervention of aromatherapy use of nurses lead to decreased anxiety, job stress, and increase in accuracy in the work lead to enhanced patient care during a 3-month intervention study. So these are just some of the jobs, kind of a background of jobs of an operating room nurse. They meet with patients and medical staff to discuss patients and procedures, planning for surgeries to ensure that the staff have all of the tools for the procedure. You don't want to be unprepared in the OR. Preparing the operating room and creating strict sterilization to provide a germ-free room. They are very anal about that. You don't want any post-operative infections that can lead to complications of the patient. Monitoring the patient's vital signs, adjusting medication, and alerting the staff to issues during the procedures is an OR nurse's job. So that's very stressful. Assisting surgical staff during the procedure, and then after everything has run through and smoothly, they have to break down the surgical room after the procedure to prepare it for sterilization for the next onboarding patient. They must also update the patient and the family on the results of the surgical process and the aftercare. So the intervention that I found studies on was aromatherapy, and the effectiveness on stress for operating room nurses. Specifically, they researched damask rose essential oil which helps to support emotional stability in the ways of addressing stress, anxiety, depression, reduce pain severity, and help improving sleep quality. So in other studies, they have also seen this used for nurses, also for patients preoperatively, and then as well as just in the general life setting. You can see essential oils being really popularly used in order to help people manage stress or anxiety, improving sleep quality. Everyone has these diffusers now, or rub essential oils on their skin. So in these different studies, there was also, I observed that there were other contributing factors to job stress that should be considered, like the COVID pandemic was one difference in the many studies that I came across. During COVID, there was also a nursing shortage, and there's a nursing shortage now. So that automatically is going to make the workload of nurses much higher, and just higher stress levels. Everyone's sick, everyone's fearful during the pandemic. Another factor to consider is the amount of the aromatherapy used. That's always something that can need to be further explored. Also, having a positive or hostile work environment can go into play in these types of studies, or the workplace attitudes of your fellow operating room personnel. Some other therapies that were assessed or used in combination with aromatherapy was massage therapy, music therapy, and I think that was it. So the goal is to minimize job stress on OR nurses and improve the accuracy to improve patient outcomes. A couple of the objectives in this overall signature assignment, trying to achieve that goal, assessing this evidence-based practice intervention was, okay, we're going to assess the stress levels preoperatively and post-op intervention with the appropriate tests and surveys. We want to implement aromatherapy and monitor the participants closely throughout the studies. We next want to identify effectiveness of the intervention and any side effects, barriers, safety considerations, and get feedback from the nurses is really important as well to take into consideration. So this is the methodology that was followed for majority of the studies that were researched, and also for the one that I made for the signature assignment. So it was a randomized control trial. It was the sample size was 200 participants, and they needed to be licensed OR nurses, at least 6 months minimum of experience. It would be a 3-month trial. They would need to upkeep a schedule that is the same. And then also we would need to get informed consent from each participant, explaining the risks and the benefits, and remind them that this is voluntary and they can drop out of the study anytime that they choose. There would be an aromatherapy group and then a control group that would receive a placebo aromatherapy. It was difficult to, or we were unable to make the study blind because aromatherapy does have a scent, the damask rose, so the placebo, the diffuser was not giving off a scent. So yes, the intervention that we would perform is a preoperative and postoperative stress assessment called the PPS, which is the perceived stress scale. Each participant would use an in-home diffuser daily for a 10-minute therapy. And then compliance would be monitored upon arrival to their job, and someone would check in with them and also assess if there were any side effects that they should be aware of, or if they are or not being compliant for the accuracy of this study. Next, we have the evaluation. So we would compare the statistical analysis to measure if there was or wasn't a reduction in stress and anxiety, and also look at all of the open-ended feedback and look at the safety of implementing this into the OR setting. Our expected outcomes and implications was that we did predict the effectiveness in decreasing job stress and anxiety and improving patient outcomes up to a certain threshold. Just like we said, something that really needs to be taken into consideration is the time period that the study is taken. So in some studies, the COVID-19 was such a high level stress that aromatherapy was not effective, did not show to be effective. But in other studies that weren't taken during that time period, they did show to have effectiveness, and it also depended on the workload within each OR unit between each hospital. So our goal in conclusion is to continue to find better ways to help the OR nurses alleviate their stress and in turn have better mental health and patient outcomes. I found this study in this Pitcock question very interesting. In the pre-op area during clinical, I found it heart-heartening to see patients come in and have such high levels of stress, and to find that, you know, their stress, it's a scary place to go into the OR. It's also high stress for nurses. And so if I were a patient going in to go get a procedure, I wanted to ask myself, would I rather have a stressed out nurse, or would I rather have a nurse who has ways and interventions to manage her stress so that my procedure can run smoothly? So that is why I chose this topic. My references. Thank you.